When it comes to healthcare issue in Africa, who are the ones mostly affected? The less privileged, because the wealthy, such as the politicians, will fled the continent and go seek medical care in developed countries, while the less privileged are left in destitute. Hi, my name is Nekme Obasoge, and today's topic is about healthcare system in Africa. One of the most challenging issues affecting people in Africa is lack of healthcare system. Every year, many people are dying from minor diseases that could have been prevented with a timely access to adequate or affordable healthcare. The question is whether or not many African countries are producing enough pharmaceutical products in the continent. For instance, according to statistics, less than 2% of the drugs consumed in Africa are produced in the continent, while 70% of all pharmaceutical products are imported to Africa, which means many African countries are not self-reliant in terms of healthcare system in the continent. In this case, how can many African countries improve healthcare system for the masses, especially for the less privileged? So today I'm going to be sitting down with some guests in my show to discuss about lack of healthcare system in Africa. Stay tuned and listen to what we have to say. Hi, my name is Nekme Obasoge, and today we are discussing about lack of healthcare system in Africa. And I'm sitting here with Pastor Tony and Mr. Otaniye Obasohan to discuss about how many African countries can improve healthcare system for the masses, especially for the less privileged. So, Pastor Tony, what do you think about today's topic?
Healthcare system in Africa did not fall apart or fall to the ground just by the government alone. Like I said before, and I always believe that the government is being run by people. So if anything is going to have to work, it has to be done by the people, because the people that run the government, they come from the society too. Yeah. And the government always have to monitor the way the healthcare system is being run in Africa.
Okay.
See, they always have to monitor the doctors, the nurses, and the medications that are being given to people. And the medications that we can buy from drugstores, either over the counter or by prescriptions.
Okay.
So the government there must be an effective way of monitoring how the healthcare system is being dispensed to people.
Okay.
Through the practice of the medical practitioners and the drugs that are available to people.
Mr. Basohan, what do you think about healthcare system? How can we produce or stimulate more healthcare system in the continent?
To my own point of view, we still have a long way to go. We have a long term and a short term. One, because we have three ways. One, the World Economic Forum, to be awareness network and financial help to Africa. Two, we have a digital technology. Then we have knowledge and skills. We have to know the rightful people to pull for the production or for the educating the masses. We will send people with skills. We will send them out to educate these people, to preach to these people. Now we preach to the world for help. We need the capital. Without capital, you can't do nothing. Okay. Like Canada here now, we can go to any of the provincial government or to the federal government. We need help because our people is dying back home they don't have money to afford healthcare. Okay, like what President Bush and Clinton they did when they raised funds. Then President Bush sent the mosquito net
to Africa,
to East Africa. At least that mosquito net he did, he rescued a lot of people we cannot afford. So now this digital technology, because every day different technology comes out. Now we have fake pharmaceutical company. Instead of producing the real rightful medication, then they will be making it like a means with a fake because they need the money.
Yeah.
Now this is where corruption still involved.
Yeah.
We need to treat this corruption because now the people who are, because we need to deal with partnership. Partnership must involve in this system.
Do you mean the government should partner with other governments outside the continent?
One, they can partner with government outside the continent, but let them have a private partnership within the country.
Do you mean among the masses they should also invent healthcare system?
Like a private body now. Like if I have money, I want to invest in healthcare system.
I mean, according to statistics, less than 2% of the drugs consumed in the continent are produced in Africa, which means we are not producing enough drugs in Africa.
No.
Pharmaceutical products, no.
Even West Africa Drug Company, even they are still importing from abroad.
Yeah.
Okay, now we have to know the exact parastatals that will be in charge of this supply, because the people in the government, if the government can put like 1 million or 2 million naira or dollars for investment, okay, let them supervise if that money were really invested in producing these pharmaceutical drugs, and let them have a good registered pharmaceutical company in abroad that representing like Africa. Okay, we are going to supply you like Maputo, I think the one we have in Canada here, that Maputo or the pharmaceutical company here. Okay, if we know this one will be producing it from Canada, then we have a direct supply to the company there.
Okay, company there.
So any money, any budget for the year, okay, we said we need about how many thousands of medication or pharmaceutical drugs we need. Okay, they give us estimate. Then we can break it down, or we measure up, we call in for a private enterprise to register who we really recognize that these people can handle the business.
According to my research, many African countries are not producing enough drugs and pharmaceutical products. How can the government or many African countries improve healthcare system for the masses?
Comment about 2 minutes ago that we don't have enough qualified people. I really do not agree with that. Nigeria produce a lot of pharmacists and doctors and nurses. I mean health care personnel. So much that when they travel out of the country, they become stars wherever they go. Look at Canada here. We have any hospital you go to, the Nigerian doctors there, they are the kind of doctors everybody say, I want to see doctor so. No, so that means we have personnel and we have, but the environment, I mentioned that before, and I'm saying the environment of manufacturing in Africa. We Africans, we don't like to invest in things that will bring money tomorrow. We want to invest in things that will bring the money now.
Okay.
That's why all our rich people, they don't want to put their money in anything that will bring money tomorrow. Only in oil that they can sell now and make their money now.
Fast money.
That's one side. The second side is the government. The government is not, the corruption in the government by the people that run the government and agencies that are supposed to be running, to be supervising the manufacturing and the importation of medical equipment, is too rife with corruption. So when they import drugs, like a report that just came from Nigeria about 2 or 3 days ago, a whole container of fake drug was seized by the customs.
From where? Coming from what?
Coming from one overseas country.
Oh my God.
And then when they manufacture, look at what is happening in Nigeria now. We have a report that some manufacturers drugs, particularly capsules, a 500 milligram drug, we only give you 100 milligram capacity. And when you go to the store to buy the drug, you buy 500 milligram drug. but they already opened the capsule, remove the drug,
manipulate it,
cut it into little pieces, and put back into the capsule.
Just to maximize their profit.
Maximize their profit. And who is supervising that?
Nobody.
The government supposed to supervise that, but because of the corruption. It passed through. And when it comes to manufacturing, some people who try to put their money in manufacturing, they don't even manufacture quality drugs. And the agencies that are supposed to supervise them and make sure that they manufacture quality drugs, they're not there. And that's another thing. Another thing is some people want to put their money in Nigeria or Africa to manufacture things. But the mentality that we Africans have, that's why I say it involves the government and non-government people too, and the whole society. Our mentality of buying foreign things, foreign shoes, foreign wristwatch, foreign clothes, foreign everything, will not let these people make profit from their money.
Oh, we add more values to imported goods than those produced locally.
We just crave for imported values. And if you don't buy imported drug or imported wristwatch or imported clothes or imported Ankara, that means you are nobody in the society.
Don't forget, like through your research, but did you research how much the government is budgeted for healthcare every year?
Yeah, it's there.
So if that money really go for the services.
No, they said many African governments are not investing enough for healthcare system in the continent. But when we say Africa, not all African countries are suffering from healthcare system, because countries like Morocco, Algeria, and Tunisia, they are doing well. They are producing like 70 to 80% of all pharmaceutical products in their own countries. Okay. You understand? Compared with countries like Nigeria, Ghana, Zimbabwe, they are not producing enough in those countries.
Okay, how many times we have introduced the free healthcare in Nigeria, particularly, it didn't work because the people there that officiate it, we are not having the skill or knowledge. Because they see the road, maybe the money to be invested there, after taking their key back, there's nothing to be done with it. Okay, these are the way, because there are we have millions upon millions of people who cannot afford medication, buy medication. Okay, what the government is supposed to do, let's pump, we have billionaires, we have millionaires. Let them raise fund, then we'll make a registered insurance to insure everybody. If you are working, you can get that insurance from your place of work. If you are not working, then the government have to come into your aid, because millions are dying every day. But our own leaders, they like exorbitant life, luxurious life. They don't care for the people that put them
masses, there. Yes.
So the only thing, like I said before, at the World Economic Forum, we have to help us, Africa, to make a network to compete to people both in and diaspora for fund, so that we can help our professionals
back home,
so that they can manufacture qualified medication.
It's difficult to take care of people that you don't care about.
Yes.
Exactly.
Yeah.
See, our society is a kind of society that we don't really care about
the less
other
privileged
people. Look at what is happening. We're talking about healthcare, how to make it work. And we're expecting the government to make it work. But the government introduced a system where some top-level government officials can use government money to go and seek medical
treatment
attention outside the country.
Yes.
So once that is in place, we cannot do anything to improve medical system in Nigeria. That's one. I mean, not only in Nigeria, in
Africa in general.
Because once people if everybody feel the pinch, necessity will bring invention.
Exactly.
But it's not the people that are supposed to feel the pinch and turn the necessity into invention. They don't feel the pinch. Immediately they get headache or they hit their foot against any stone or they cut in their nails and they cut their finger, they go to India or go to Turkey or go to England to seek medical help. So they cannot do anything. And this is the way we have always been ever since, and we are still the same way. We don't care. People that have the capacity, they don't care about people that don't have the capacity in our society. Until we remove that, then we can be talking about improving healthcare system. If we don't remove that, we are just talking. That's it.
I was wondering, African governments, they will always fled the country and go to developed countries for medical help.
No, people running the government.
Why are they not taking that healthcare system in developed countries and say, look, it's better for me to take this to my country and just go invest it in my country instead of me flooding my own countries to seek medical help in foreign lands?
In that aspect.
I don't understand African leaders.
They feel insecure with the treatment they're going to take there. They don't know who is here. Maybe they can use the doctor to give them injection. Yes, because they
don't trust the medical system there. Because even though they take it back to their country,
even though they trust the medical system there, or they don't trust the human, the person who's going to do it, because they don't know where he must have been instigated. The government need to come out and introduce, invite private sectors. Give them license, give them like insurance company. There are a lot of insurance companies that can run this pharmaceutical business with good system, everything. But the bill they will double. They will double charge the government, all right? Because the person who's going to sign that bill, he have his own share. Okay, now to go to custom department, they need to see fees there. Before coming to the private sector now, if they don't have money to purchase it, because see how much that is following the whole system.
Yeah. One thing, according to what Pastor Tony just said, that the government really don't care so much about the masses. That is just the thing.
The people in the government.
The people.
I stand to correct you about all that. The people in the government.
The people in the government.
I always stand to point out also that the people in the government.
Yeah, it's the same as the government.
Us too. Yeah. There are people like myself and yourself.
Yeah.
So in our society, we have to develop a heart of caring first, because once the foundation is not correct, you cannot build a correct house.
The water will flow it.
You see, once your foundation is cracked, the building, no matter what kind of design you have there, the building is going to be in a mess. That's what happened. The foundation of our society is that we don't really care about other people.
Okay.
You see, we don't do things in a way that is going to be okay for tomorrow. We just do things that will be okay for now.
You know, the norm of the government, the system, political system in Africa is that come there, chop and go. Take yours and go.
This is exactly what
that is the problem. You understand?
Tomorrow,
many of them, they are not there to really carry out their professionalism.
Okay, now it is our duty now. If you are not doing your job, let the masses get up and say, we don't want you in that position because you are not functioning. If we can do that, then let us put the right person. Okay, you cannot take somebody who studied engineer to be on that pharmaceutical company, because his own is to construct bridge. So put the risky. You see, this is where I come back to the knowledge and skill, because every day different new technology is coming out. So we have to invest in all these things. Let somebody who want to be a commissioner of that or a federal minister of health to really know what is there for. Let him not think of his pocket. Let him think of the people. Then his job is going to be done. Let him make the name, not the riches, for himself.
I hope we can get some people like that in the system, so that there will be a negotiation how they can import drugs and pharmaceutical products to the continent, and also help them to develop their own products in Africa. Pastor Tony, what do you think many African countries can do to improve healthcare system for the masses?
have the heart of caring.
Okay.
We Africans, we don't care about our own people. Listen to this. We don't run people by just knowing in our head. We run people from our hearts. The position of our heart in Africa needs to be normalized, need to be rearranged. We need to reposition our heart to care about other people.
Outside our family.
Yeah, and not just ourselves alone.
What do you think many African countries should do to improve healthcare system?
Yeah, they have a lot because they have to invite a private partnership.
Okay.
And secondly, you see, like all those our leaders that enjoy exorbitantly without even caring for his people, they let the foreign country send a message to all of them.
Okay.
You see, like the foreign, like the network.
Okay.
They bring the people feeding the garbage, feeding in poverty, all those sort of things. They should not show it to the public. Let the president, the foreign country have to send a message to the president. You see your people. Then how many parties is he staging every day in his top office? They have to go and care for his people.
Okay.
If you don't want to do it, not even God can make you do it.
It's truth, yeah. That is so true.
Not even God.
Yes.
What can foreign power do to make you help your people, to make you care for your people, if your heart don't care for them? I keep telling you, we need to go check our heart.
For the healthcare system, what are you proposing for Africa?
Let us care about our people.
Okay, first.
Let us have a heart of caring.
Caring, how
That's
to
what I
manage
propose.
our countries before thinking.
Heart of caring,
yeah.
not manage.
Okay, heart of caring.
Yeah.
What do you think?
Yeah, we want everybody to get this message where they're sending now to work together to make sure we change that system of our health service. Because either donation, either the recognized insurance company, partnership, they have to come together. They let government come out with what they have. So that the commoner can add to it too, so that we can build. We can start with communities.
Okay.
We can start with communities.
Okay.
State, then the federal will now say, okay, this state, they are trying, they will add to their budget.
Okay.
So that is my message to
For me, what I'm proposing for many African countries, the political leaders should work with developed countries and make sure they help them to import some pharmaceutical products, drugs to the continent. Also help African countries to produce their own brands in the continent, so that they will be self-reliant instead of relying on foreign products. You understand? Because locally produced products are more cheaper and accessible to locals than those imported.